client needs, psychosocial integrity, cognitive level, application 103. 1. The argument should already be in a private area because the argument ensued during report. Report should always be held in a confidential area. 2. The CNO should evaluate the concerns of each charge nurse and then make a decision as to a plan of care for the resident. The CNO is the next in command over the charge nurses in an extended care facility. 3. This argument does not involve the family. If, after listening to both sides, the CNO thinks there is a need for a family member's input, then the CNO could contact the family, but a decision should be made until this can occur. 4. The nurses each have a concern over a resident. This situation should be resolved before continuing report. Content: management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 104. 1. Calling a timeout when a discrepancy is noted on the surgical permit is an appropriate action to prevent an error during a surgical procedure. 2. The Joint Commission requires 2 identifiers be utilized prior to administering medications. Most hospitals use the client's date of birth for the second identifier. This is an appropriate action to prevent an error during a medication administration. 3. A quiz during orientation is given to assess whether the new employee Chapter 15 Comprehensive Exam 465 understands the information being taught. Giving the answers to the quiz completes the required documentation for the employee's files but does not ensure the new hire understands how to utilize the 4-pump. This is a violation of the patient safety goals. 4. Initiating a fall prevention program for an older adult client to prevent falls is an appropriate action to attempt to ensure client safety. Content: management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 105. 1. This client should be categorized as black, priority 4, which means the injury is extensive and chances of survival are unlikely even with definitive care. Clients should receive comfort measures and be separated from other casualties but not abandoned. 2. This client should be categorized as red, priority 1, which means the injury is life-threatening but survivable with minimal intervention. These clients can deteriorate rapidly without treatment. 3. This client should be categorized as green, priority 3, which means the injury is minor and treatment can be delayed hours to days. These clients should be moved away from the main triage area. 4. The client should be categorized as a yellow, priority 2, which means the injury is significant and requires medical care but can wait hours without threat to life or limb. Clients in this category receive treatment only after immediate casualties are treated. Content: triage, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis 106. 1. The normal white blood cell count is 5.0 to 10.0 mm3, therefore, this client does not require immediate intervention. 2. The client's cholesterol level is elevated, but this would not require immediate intervention by the nurse. An elevated cholesterol level is not life-threatening and can be discussed at the client's next appointment. 3. The client's calcium level is within the normal range of 9.0 to 10.5 mg/dl. Therefore, this client does not require an immediate intervention. 4. The therapeutic range for an INR is 2 to 3. This client is at risk for bleeding and requires immediate intervention by the nurse. The nurse should call the client and instruct the client to stop taking warfarin, Coumadin, an anticoagulant. Content: medical/surgical, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 107. 1. A spokesperson should address the media away from the victim care area as soon as possible. This could be a nurse in some situations, but it is not the priority intervention when triaging victims. 2. The disaster tag number and the client's name should be recorded in the disaster logbook, but it is not the priority intervention. The disaster tag must be attached to the client prior to logging the client into the disaster logbook. 3. Client tracking is a critical component of casualty management. Disaster tags, which include name, address, age, location, description of injuries and treatments or medications administered, must be securely attached to the client. 4. Family and friends arriving at the disaster must be cared for by the disaster workers, but it is not the first intervention for the nurse who is triaging disaster victims. Content, triage, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 108. 1. Parish nursing emphasizes the relationship between spiritual faith and health. A parish nurse, PN, is a registered nurse with a minimum of 2 years' experience who works in a faith community to address health issues of its members as well as those in the broader community or neighborhood. 2. The parish nurse works in the community, not in an acute care setting. 3. There is no such thing as a parish clinic. 4. The parish nurse can be an RN or an LPN. Content, community health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 109. 1. The client's HCP may need to be notified, but it is not the nurse's first intervention. 2. The nurse must first assess the reddened area to determine the stage of the pressure ulcer and what treatment should be recommended. Exam answers 466. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 3. The reddened area should be documented in the chart, but this is not the first intervention. 4. The client may or may not need to be referred to a wound care nurse, but it is not the nurse's first intervention. If the reddened area is stage 1 or 2, the wound care nurse probably would not be notified. Content, medical/surgical, category of health alteration, integumentary, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application 110. 1. The occupational therapist assists the client with activities of daily living, not with employment concerns. 2. The NCLEX-RN registered test blueprint lists referrals under management of care. After a client has been injured and is unable to return to previous employment because of the injury, the Rehabilitation Commission of each state will help evaluate the client and determine whether the client is eligible to receive training or education for another occupation. 3. The client is not asking about disability but rather about employment. The nurse needs to refer the client to the appropriate agency. 4. The client should discuss his concerns with his wife, but the nurse should refer the client to an agency that can address his concerns about employment. Content, management of care, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 111. 1. The mother may want to see her infant before the body is removed from the room. 2. The infant's body will be sent to a funeral home. The parents will not be allowed to take the body home. 3. The body should be treated with the dignity accorded to any human remains. 4. The nurse can present the parents with a lock of the infant's hair and a set of footprints. Giving the parents something of the infant helps with the grieving process. Content, caring, category of health alteration, neonatal, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 112. 1. Nasal flaring and grunting indicate the infant is in respiratory distress. The nurse should assess this infant first. 2. The nurse would not worry about the infant not passing meconium until 20 to 24 hours after birth. The nurse would not assess this infant first. 3. This situation requires teaching the mother and patients, but the infant is not in distress. The nurse would not assess this infant first. 4. This is normal for a newborn. The nurse would not assess this infant first. Content: medical/surgical, category of health alteration, pediatrics, integrated processes, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 113. 1. Because this client is reporting an incident that occurred hours ago and she is not in imminent danger, this client is not the first client the nurse should call. 2. The nurse should return this call first because the nurse must determine whether the client has a plan for suicide. 3. Not wanting to eat is part of the anorexia disease process. The nurse does not need to return this call first. 4. Hand trembling is part of the Parkinson's disease process. Control of the symptoms of Parkinson's disease is affected by several factors, including the amount of sleep the client had, fatigue, and the development of tolerance to the medications. Because this client is not at risk for suicide, he is not the first client for the nurse to see. Content: medical/surgical, category of health alteration, mental health, integrated processes, nursing process, assessment, client needs, psychosocial integrity, cognitive level, analysis 114. 1. Pediatric clients in a psychiatric facility must keep up with schoolwork. Clients must be escorted from one building to another. The MHW should be assigned to this task. 2. The MHW is not qualified for this task to lead a group therapy session. 3. Explaining the purpose of recreation therapy is teaching, and teaching cannot be delegated to an MHW. 4. Clients in a psychiatric facility are expected to meet their own hygiene needs as part of assuming responsibility for themselves. This is not the best task to assign to the MHW. Content: medical/surgical, category of health alteration, mental health, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 115. 1, 2, and 5 are correct. 1. Smoking while taking birth control pills increases the risk of adverse reactions such as formation of blood clots. Chapter 15 Comprehensive Exam 467-2. The client should take the pill at approximately the same time each day to maintain a blood level of the hormone. 3. The client should be instructed to take a missed pill as soon as she realizes she missed the dose during the intervening 24 hours. However, if the client doesn't realize she missed the pill until the next day, she should not take 2 pills at that time. 4. Breakthrough bleeding may indicate a change in dose is needed, but the client should not stop taking the pill. 5. There may be interactions with other medications. Many antibiotics interfere with the action of the birth control pill, and the client should use other contraceptive methods when on an antibiotic. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, planning, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis 116. 1. Vaginal itching while receiving antibiotics indicates that the good bacterial flora in the vagina is being destroyed. Yogurt contains these bacteria and can replace the needed bacteria. However, requesting the dietary department to send yogurt each day is not the priority intervention. 2. The nurse should first explain to the client that this is a side effect of the antibiotic medication. Then, the nurse should notify the dietitian and HCP. The antibiotic therapy cannot be discontinued because of the need for antibiotic therapy after knee replacement surgery. 3. The HCP should be notified of the vaginal itching, but it is not an emergency and can wait until the HCP makes rounds. 4. The client's sexual history is not a concern because the vaginal infection is secondary to the antibiotic therapy. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application processes. 117. 1. The manager should ask for input into the budgetary needs from the staff, but an assessment of the current year's budget is the first step. 2. An assessment of the costs of any new department projects should be done, but the first step is to assess the present budget. 3. The first step in a budgetary process is to assess the current budget. 4. Explaining the new budget to the staff is the last step in the process. Content: management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. 118. 1. The nurse should confront the client with the behavior, but this is not the first intervention. 2. The nurse should document the behavior in the client's chart, but this is not the first intervention. 3. The nurse should intervene to stop the behavior first before one of the clients is injured. Approaching the client with another staff member shows strength and provides the nurse with the ability to perform a safe takedown. 4. The client should be told to return to the room, but stopping the behavior is the first intervention. Content: medical/surgical, category of health alteration, mental health, integrated processes, nursing process, implementation, client needs, safe effective care environment, safety and infection control, cognitive level, application. 119. 1. This surgeon should speak with the client, but the first intervention is to stop the procedure. 2. Asking the client to discuss concerns should be done, but the first intervention is to stop the procedure. 3. Continuing to prep the client for the surgery can be done, but is inappropriate when the client no longer is giving consent. 4. Stopping the surgical procedure is the first intervention for the nurse to implement. Content: medical/surgical, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application. 120. 1. 4 episodes of mania in 6 months do not indicate therapy has been effective. 2. The ability to hold a job for 9 months indicates the client is responding to therapy. 3. Wearing a nightgown to the day room does not indicate the client is responding to treatment. 4. 3 motor vehicle accidents do not indicate the client is responding to treatment. Content: medical/surgical, category of health alteration, mental health, integrated processes, nursing process, evaluation, client needs, psychosocial integrity, cognitive level, synthesis. Exam answers 469. These values are obtained from Davis's Comprehensive Handbook of Laboratory and Diagnostic Tests with Nursing Implications. Laboratory results may differ slightly depending on the resource manual or the laboratory normal values. Arterial blood gas adult pH 7.35 to 7.4. 5 pCO2 35 to 45 mm Hg HCO3 22 to 26 milliequivalent/LPOW 280 to 100 mm HgO2 saturation 93% to 100% chemistry 7 adult cholesterol less than 200 mg/dL HDL 40 to 65 mg/dL LDL less than 200 mg/dL creatinine 0.6 to 1.2 mg/dL glucose 60 to 110 mg/dL potassium 3.5 to 5.5 milliequivalent/L sodium 135 to 145 milliequivalent/L triglycerides less than 150 mg/dL blood urea nitrogen 10 to 31 mg/dL blood count adult hematocrit HCT male 43% to 49% female 38% to 44% hemoglobin male, 13.2 to 17.3 g/dL female, 11.7 to 15.5. G/DL activated partial thromboplastin time, APTT, 25 to 35 seconds. Prothrombin time, PT, 10 to 13 seconds. Red blood cell count, RBC, male, 4.7 to 5.1 106 cells/mm3. Female, 4.2 to 4.8 106 cells/mm3. White blood cell count, WBC, 4.5 to 11.0. 1,000/mm3. Platelets 150 to 450. 103/L/mm3. Erythrocyte sedimentation rate, ESR, male, 0 to 20 mm/HR. Female, 0 to 30 mm/HR. Normal laboratory values 470. Normal laboratory values. Drug levels. Adult digoxin, lanoxin, 0.8 to 2.0 ng/ml. International normalized ratio, INR, 2 to 3. 2.5 to 3.5. If the client has a mechanical heart valve, lithium milliequivalent/L 0.6 to 1.2. Milliequivalent/L phenytoin, dilantin, 10 to 20 mcg/ml. Theophylline, aminophylline, 10 to 20 mcg/ml. Valproic acid, Depakote, 50 to 100 mcg/ml. Vancomycin trough level 10 to 20 mcg/ml. Vancomycin peak level 30 to 40 mcg/ml. 471. Glossary of English words commonly encountered on nursing examinations. Abner, malady, defect, irregularity, anomaly, oddity. Absence, non-appearance, lack, non-attendance. Abundant, plentiful, rich, profuse. Accelerate, go faster, speed up, increase, hasten. Accumulate, build up, collect, gather. Accurate, precise, correct, exact. Achievement, accomplishment, success, aching, attainment. Acknowledge, admit, recognize, accept, reply. Activate, start, turn on, stimulate. Adequate, sufficient, ample, plenty, enough. Angle, slant, approach, direction, point of view. Application, use, treatment, request, claim. Approximately, about, around, in the region of, mo. Or less, roughly speaking. Arrange, position, place, organize, display. Associated, linked, related. Attention, notice, concentration, awareness, thought. Authority, power, right, influence, clout, expert. Avoid, keep away from, evade, let alone. Balanced, stable, neutral, steady, fair, partial. Barrier, barricade, blockage, obstruction, obstacle. Best, most. Excellent, most important, greatest. Capable, able, competent, accomplished. Capacity, ability, capability, aptitude, role, power, size. Central, middle, mid, innermost, vital. Challenge, confront, dare, dispute, test, face up to. Characteristic, trait, feature, attribute, quality, typical. Circular, round, spherical, globular. Collect, gather, assemble, amass, accumulate, bring together. Commitment, promise, vow, dedication, obligation, pledge, assurance. Commonly, usually, normally, frequently, genera. LLY, universally. Compare, contrast, evaluate, match up to, weigh or judge against. Compartment, section, part, cubicle, booth, stall. Complex, difficult, multifaceted, compound, multi-part, intricate. Complexity, difficulty, intricacy, complication. Component, part, element, factor, section. Constituent. Comprehensive, complete, inclusive, broad, thorough. Conceal, hide, cover up, obscure, mask, suppress, secrete. Conceptualize, to form an idea. Concern, worry, anxiety, fear, alarm, distress, unease, trepidation. Concisely, briefly, in a few words, succinctly. Conclude, make a judgment based on reason, finish. Confidence, self, assurance, certainty, poise, self, reliance, congruent, matching, fitting, going together well, consequence, result, effect, outcome, end result, constituents, elements, component, parts that make up a whole, contain, hold, enclose, surround, include, control, limit, continual, repeated, constant, persistent, recurrent, frequent, continuous, constant, incessant, non-stop, unremitting, permanent, contribute, be a factor, add, give, convene, assemble, call together, summon, organize, arrange, convenience, expediency, handiness, ease, coordinate, organize, direct, manage, bring together, create, make, invent, establish, generate, produce, fashion, build, construct, creative, imaginative, original, inspired, inventive, resourceful, productive, innovative, critical, serious, grave, significant, dangerous, life-threatening. See UE, signal, reminder, prompt, sign, indication, curiosity, inquisitiveness, interest, nosiness, snooping, damage, injure, harm, hurt, break, wound, deduct, subtract, take away, remove, withhold, deficient, lacking, wanting, underprovided, scarce, faulty, defining, important, crucial, major, essential, significant, central, diffuse, resolve, calm, soothe, neutralize, rescue, mollify, delay, hold up, wait, hinder, postpone, slow down, hesitate, linger. 472 Glossary of English words commonly encountered on nursing examinations: demand, insist, claim, require, command, stipulate, ask, describe, explain, tell, express, illustrate, depict, portray, design, plan, invent, intend, aim, propose, devise, desirable, wanted, pleasing, enviable, popular, sought after, attractive, advantageous, detail, feature, aspect, element, factor, facet, deteriorate, worsen, decline, weakened it, determine, decide, conclude, resolve, agree on, dexterity, skillfulness, handiness, agility, deftness, dignity, self, respect, self, esteem, decorum, formality, poise, dimension, aspect, measurement, diminish, reduce, lessen, weaken, detract, moderate, discharge, release, dismiss, set free, discount, inu, stop, cease, halt, suspend, terminate, withdraw, disorder, complaint, problem, confusion, chaos, display, show, exhibit, demonstrate, present, put on view, dispose, to get rid of, arrange, order, set out, dissatisfaction, displeasure, discontent, unhappiness, disappointment, distinguish, to separate and classify, recognize, distract, divert, sidetrack, entertain, distress, suffering, trouble, anguish, misery, agony, concern, sorrow, distribute, deliver, spread out, hand out, issue, dispense, disturbed, troubled, unstable, concerned, worried, distressed, anxious, uneasy, div. Original, serving to distract, don, put on, dress oneself in, dramatic, spectacular, drape, cover, wrap, dress, swathe, dysfunction, abnormal, impaired, edge, perimeter, boundary, periphery, brink, border, rim, effective, successful, useful, helpful, valuable, efficient, not wasteful, effect. Competent, resourceful, capable, elasticity, stretch, spring, suppleness, flexibility, eliminate, get rid of, eradicate, abolish, remove, purge, embarrass, make uncomfortable, make self-conscious, humiliate, mortify, emerge, appear, come, materialize, become known, emphasize, call attent. Ion 2, accentuate, stress, highlight, ensure, make certain, guarantee environment, setting, surroundings, location, atmosphere, milieu, situation, episode, event, incident, occurrence, experience, essential, necessary, fundamental, vital, important, crucial, critical, indispensable. Etiology. Assigned cause, origin, exaggerate, overstate, inflate, excel, to stand out, shine, surpass, outclass, excessive, extreme, too much, unwarranted exertion, intense or prolonged physical effort, exhibit, show signs of, reveal, display, expand, get bigger, enlarge, spread out, increase, swell. Inflate, expect, wait for, anticipate, imagine, expectation, hope, anticipation, belief, prospect, probability, experience, knowledge, skill, occurrence, know, how, expose, lay open, leave unprotected, allow to be seen, reveal, disclose, exhibit, external, outside, exterior, outer, facilita. Make easy, make possible, help, assist, factor, part, feature, reason, cause, think, issue, focus, center, focal point, hub, fragment, piece, portion, section, part, splinter, chip, function, purpose, role, job, task, furnish, supply, provide, give, deliver, equip, further, additional, mo. Extra, added, supplementary, generalize, to take a broad view, simplify, to make inferences from particulars, generate, make, produce, create, gentle, mild, calm, tender, girth, circumference, bulk, weight, highest, uppermost, maximum, peak, main, hinder, hold back, delay, hamper, obstruct. Impede, humane, caring, kind, gentle, compassionate, benevolent, civilized, ignore, pay no attention to, disregard, overlook, discount, imbalance, unevenness, inequality, disparity, immediate, insistent, urgent, direct, impair, damage, harm, weaken, implantation, to put in, impotent, powerless, weak, incapable, ineffective, unable, inadvertent, unintentional, chance, unplanned, accidental, include, comprise, take in, contain, indicate, point out, sign of, designate, specify, show, ineffective, unproductive, unsuccessful, useless, vain, futile, inevitable, predictable, to be expected, unavoidable, foreseeable, influence, power, pressure, sway, manipulate, affect, effect, initiate, start, begin, open, commence, instigate, insert, put in, add, supplement, introduce, inspect, look over, check, examine, inspire, motivate, energize, encourage, enthuse, institutionalize. To place in a facility for treatment, integrate, put together, mix, add, combine, assimilate, integrity, honesty. Glossary of English words commonly encountered on nursing examinations. 473. Interfere, get in the way, hinder, obstruct, impede, hamper. Interpret, explain the meaning of, to make. Understandable, intervention, action, activity. Intolerance, bigotry, prejudice, narrow mindedness. Involuntary, instinctive, reflex, unintentional, automatic, uncontrolled. Irreversible, permanent, irrevocable, irreparable, unalterable. Irritability, sensitivity to stimuli, fretful, quick. Excitability, justify, explain in accordance with reason, likely, probably, possible, expected. Liquefy, to change into or make more fluid. Logical, using reason. Longevity, long life. Lowest, inferior in rank. Maintain, continue, uphold, preserve, sustain, retain. Majority, the greater part. Of mention, talk about, refer to, state, cite, declare, point out minimal, least, smallest, nominal, negligible, token minimize, reduce, diminish, lessen, curtail, decrease to smallest possible mobilize, activate, organize, assemble, gather together, rally modify, change, adapt, adjust, revise, alter moist, slightly wet, damp multiple, many, numerous, several, various natural, normal, ordinary, unaffected negative, no, harmful, downbeat, pessimistic negotiate, bargain, talk, discuss, consult, cooperate, settle notice, become aware of, see, observe, discern, detect not. EFA, inform, tell, alert, advise, warn, report nurture, care for, raise, rear, foster obsess, preoccupy, consume occupy, live in, inhabit, reside in, engage in occurrence, event, incident, happening odorous, scented, stinking, aromatic offensive, unpleasant, distasteful, nasty, disgusting. NG opportunity, chance, prospect, break organize, put in order, arrange, sort out, categorize, classify origin, source, starting point, cause, beginning, derivation pace, speed parameter, limit, factor, limitation, issue participant, member, contributor, partaker, applicant perspective. Viewpoint, view, perception position, place, location, point, spot, situation practice, do, carry out, perform, apply, follow precipitate, to cause to happen, to bring on, hasten, abrupt, sudden predetermine, fix or set beforehand predictable, expected, knowable preference, favorite. Liking, first choice prepare, get ready, plan, make, train, arrange, organize prescribe, set down, stipulate, order, recommend, impose previous, earlier, prior, before, preceding primarily, first, above all, mainly, mostly, largely, principally, predominantly primary, first, main, basic. Chief, most important, key, prime, major, crucial priority, main concern, giving first attention to, order of importance production, making, creation, construction, assembly profuse, a lot of, plentiful, copious, abundant, generous, prolific, bountiful prolong, extend, delay, put off, lengthen, draw out promote, encourage, support, endorse, sponsor proportion, ratio, amount, quantity, part of, percentage, section of provide, give, offer, supply, make available rationalize, explain, reason realistic, practical, sensible, reasonable receive, get, accept, take delivery of, obtain recognize, acknowledge, appreciate, identify, aware of recovery, healing, mending, improvement, recuperation, renewal reduce, decrease, lessen, ease, moderate, diminish re-establish, reinstate, restore, return, bring back regard, consider, look upon, relate to, respect regular. Usual, normal, ordinary, standard, expected, conventional relative, comparative, family member relevance, importance of reluctant, unwilling, hesitant, disinclined, indisposed, adverse reminisce, to recall and review remembered experiences remove, take away, get rid of, eliminate, erratic. 8. Reposition, move, relocate, change position require, need, want, necessitate resist, oppose, defend against, keep from, refuse to go along with, defy resolution, decree, solution, decision, ruling, promise resolve, make up your mind, solve, determine, decide response, reply, answer. Reaction, retort restore, reinstate, re-establish, bring back, return to, refurbish, restrict, limit, confine, curb, control, contain, hold back, hamper, retract, take back, draw in, withdraw, apologize, reveal, make known, disclose, divulge, expose, tell, make public. 474 Glossary of English. Ish words commonly encountered on nursing examinations: review, appraisal, reconsider, evaluation, assessment, examination, analysis, ritual, custom, ceremony, formal procedure, rotate, turn, go around, spin, swivel, routine, usual, habit, custom, practice, satisfaction, approval, fulfillment, pleasure, happiness, satisfy, please, convince, fulfill, make happy, gratify, secure, safe, protected, fixed firmly, sheltered, confident, obtain, sequential, chronological, in order of occurrence, significant, important, major, considerable, noteworthy, momentous, slight, small, slim, minor, unimportant, insignificant, insult, snub, source, basis, foundation, starting place, cause, specific, exact, particular, detail, explicit, definite, stable, steady, even, constant, statistics, figures, data, information, subtract, take away, deduct, success, achievement, victory, accomplish, meant, surround, enclose, encircle, contain, suspect, think, believe, suppose, guess, deduce, infer, distrust, doubtful, sustain, maintain, carry on, prolong, continue, nourish, suffer. Synonymous, same as, identical, equal, tantamount, systemic, affecting the entire organism. Thorough, careful, detailed, methodical, systematic, meticulous, comprehensive, exhaustive. Tilt, tip, slant, slope, lean, angle, incline, translucent, see, through, transparent, clear, unique, one and only, sole, exclusive, distinctive, universal, general, widespread, common, worldwide, unoccupied, vacant, not busy, empty, unrelated, unconnected, unlinked, distinct, dissimilar, irrelevant, unresolved, unsettled, uncertain, unsolved, unclear, in doubt. Utilize, make use of, employ. Various, numerous, variety, range of, mixture of, assortment of. Verbalize, express, voice, speak, articulate. Verify, confirm, make sure, prove, attest to, validate, substantiate, corroborate, authenticate. Vigorous, forceful, strong, brisk, energetic. Volume, quantity, amount, size. Withdraw, remove, pull out, take out, extract. 475 Index A, abandonment. 359 Abdominal aortic aneurysm. 51, 53 to 54, 71, 73 to 74 Abnormal involuntary movement scale. 375, 392 to 393 Abruptio placentae. 315 Absolute neutrophil count. 283, 300 Abused child. 344, 360, 368, 385, 435, 454 Elder. 47, 65, 442, 463 Women's health management. 305, 321 Acceptance stage, of dying. 114, 130 Acetyl salicylic acid. 176, 191 Acro megaly. 209, 223 Active tuberculosis. 80, 96 Acupressure. 213, 229 to 230 Acupuncture. 248, 267, 434, 452 acute bronchitis, 81, 96 acute diverticulitis, 120, 130, 139 acute gastroenteritis, 111, 124 acute post-streptococcal glomerulonephritis, 143, 156 acute respiratory distress syndrome, ARDS. 79, 86, 93, 104 acyclovir, 176, 192 Addison's disease, 211 to 212, 225, 227, 233 advanced directives, 113, 115, 127, 131, 209, 222, 274, 288, 430, 447 agoraphobia, 364, 379 AIDS, 280, 297 Alcoholics Anonymous, 369, 387 Alcoholism, 369, 387 Allergic contact dermatitis, 263 Alzheimer's disease, 174, 176, 188, 192, 370, 389 Americans with Disabilities Act, 258 Anencephaly, 308, 326 Angina, 14, 21, 35, 41 Angiomas, 264 Antacids, 370, 389 Anticipatory grieving, 283, 299 to 300 Anticipatory nausea, 293 Antiplatelet agents, 15, 36 Antiplatelet medications, 441, 461 Antitubercular medications, 370, 389 Apical pulse, 113, 127, 148, 165 Arguing, 146, 162, 213, 229, 272, 285, 429, 446 Aricept, 111, 124 Aromatherapy, 230 Arterial blood gases, 80, 86, 95, 105, 112, 126 Arterial hypertension, 47, 63 Arterial occlusive disease, 47, 52, 64, 71 Client teaching, 51, 70 Immediate interventions 4, 54, 74 Asbestosis, 79, 93 Ascites, 111, 124 Aspartate aminotransferase test, 13, 32 Aspirin, 12, 30, 44, 57, 176, 191 Assault, 364, 366, 383 Assessment of clients in cardiovascular management, 7, 20, 22, 40 in endocrine management, 211, 213, 224, 229 to 230 in gastrointestinal management, 109, 111 to 112, 118 to 119, 122, 125 to 126, 136 to 137 in hematological and immunological management, 277, 293, 431, 449 in integumentary management, 239, 252 in neurological management, 173, 176, 178, 186 to 187, 191, 197, 205 in Pediatric Health Management, 333, 342, 345, 347, 358, 361, 43. 451 in Peripheral Vascular Management, 50 to 52, 54 to 55, 68 to 72, 74 in Renal and Genitourinary Management, 141, 144 to 145, 149, 154, 159 to 160, 166 in Respiratory Management, 78, 91 in Women's Health Management, 301, 306, 314, 322 Assigning Care, 4 to 5 Asthma, 116, 132, 139 Atenolol, 248, 266 Atherosclerosis, 44, 54, 57, 74 Atorvastatin, 10, 27 Atrial fibrillation chronic, 12, 30 International Normalized Ratio in patient with, 11, 28 Medication administration for, 10, 27 Autocratic leadership style, 343, 359 Autonomic dysreflexia, 204 Autonomy, 50, 69, 305, 320 B. Babinski reflex, 3. 31 Bacterial meningitis, 186, 205, 361 Bargaining stage, of dying, 114, 130 Barium study, 109, 122 Barrett's esophagitis, 116, 132 Barrett's esophagus, 111, 124 Basal cell carcinoma, 246, 264 Benign prostatic hypertrophy, 143, 158 Bereavement counseling, 115, 131 Beta blockers, 248, 266 Bipolar disorder, 367, 369, 385, 387, 445, 467 Birth control pills, 445, 466 to 467 Bisacodyl, 248, 266 Bisphosphonates, 144, 159 Blood transfusions Cardiovascular management, 8, 16, 24, 36 to elderly patients, 45, 60 Peripheral vascular management, 44 to 45, 49, 59 to 60, 67 reactions to, 44, 59 bomb scare protocol, 371, 389 to 390, 441, 462 botulism, 178, 196 brainstem herniation, 186, 205 Braxton Hicks contractions, 303, 312, 317, 330 bronchiectasis, 84, 101 bronchiolitis, 87, 106 budgetary process, 445, 467 476 index burns, 247, 250 to 251, 265 to 266, 269, 436, 455 Bisonosis, 84, 101 C. Calcium channel blockers, 9, 11, 25, 29 Cane ambulation, 246, 264 Caput succedaneum, 306, 322 cardiac arrest, 16, 37 cardiac rehabilitation, 12, 31 cardiomyopathy, end-of-life care 4, 13, 32 cardiopulmonary resuscitation nurses actions 4, 82, 98 by unlicensed assistive personnel, 10. 27 cardiovascular management assessment prioritization for clients, 7, 20, 22, 40 blood transfusions, 8, 16, 24, 36 case manager, 8, 23 charge nurse, 8 to 9, 24 to 25 client assignments by charge nurse, 7 to 9, 22 to 23, 25 clinical scenario, 20 to 21, 40 to 41 delegation of care to licensed practice nurses. 14, 34 to unlicensed assistive personnel, 9, 13 to 14, 20, 25, 33 to 34, 40 to volunteers, 13, 33 home health nurse, 12, 29 to 30 laboratory tests, 20, 40 licensed practice nurses in, 14, 34 medication administration, 7 to 8, 10, 13, 15, 17, 22, 24, 27, 32, 35 to 36, 38 prioritization of interventions, 1, 2 to 13, 20, 30 to 31, 33, 40 unlicensed assistive personnel in, 8 to 9, 20, 23, 25, 40 case management benefits of, 11, 28 to 29 integumentary management, 243 to 244, 259 to 261 pediatric health management, 338, 354 case manager client assignments to, 212, 228 information sharing with, 8, 23 neurological referrals by, 174, 188 responsibilities of, 11, 28 to 29 case studies critical care, 400 to 402, 416 to 417 home health, 406 to 408, 421 to 423 maternal child, 412 to 413, 426 to 427 medical nursing, 397 to 399, 414 to 415 mental health nursing, 409 to 411, 424 to 425 outpatient nursing, 403 to 406, 418 to 420 cataracts, 176, 192, 199 cellulitis, 247, 265 cephalohematoma, 306, 322, 331 cerebral palsy, 335 cerebrospinal fluid drainage, 212, 227 cerebrovascular accident, 9, 26, 174, 176 to 178, 183, 185, 188, 193, 195, 203 to 204 change process, 49, 67 chaplain, 211, 225 charge nurse client assignments by in cardiovascular. R management, 7 to 10, 22 to 23, 25 to 26 in critical care unit, 432, 449 in day surgery center 142, 155, 431, 449 in endocrine management, 210, 224 in gastrointestinal management, 116, 132 in hematological and immunological management, 272 to 273, 279, 285, 287, 295 in integumentary management, 242, 24. 5, 256, 261 to 262 in mental health management, 365, 371 to 372, 381, 390 to 391 in neurological management, 173, 175, 188, 190 in pediatric health management, 336, 341, 345 to 346, 350 to 351, 357, 361 to 362, 431, 449 in renal and genitourinary management, 142, 155 in respiratory management, 77, 86, 90, 105. In women's health management, 302 to 303, 305, 309, 312, 316 to 318, 320, 328, 330 conflict resolution by 437, 457 delegating and assigning of care in gastrointestinal management, 110, 123 in peripheral vascular management, 48, 66 in renal and genitourinary management, 142, 155 in respiratory management, 80, 87, 95, 106 disciplining by 115, 132 drug screening of 271, 284, 429, 446 nursing staff management by in integumentary management, 242, 256 in peripheral vascular management, 43, 56 in renal and genitourinary management, 146, 162 in respiratory management, 80, 95 research articles and 45, 59 respiratory management, 83, 101 chemical injuries, 180, 201 chemotherapy, 283, 300 chest pain medication administration for 17, 38 prioritization of interventions for 19, 21, 39, 41, 51, 69 questions about 12, 14, 30, 33, 35 chest tubes, 84, 86, 101 to 102, 105, 434, 452 to 45. 3 Cheney-Stokes respiration, 214, 232 Chief Nursing Officer, 443, 464 Xinyan, 306, 322 Child Abuse, 344, 360, 368, 385, 435, 454 Childhood Developmental Specialist Referrals, 339 to 340, 355 to 356 Children. See Pediatric Health Management. Chronic atrial fibrillation, 12, 30 Chronic kidney disease, 147, 149, 164, 166, 434, 453 Chronic obstructive pulmonary disease, 82, 84, 88, 98 to 99, 101, 107 Chronic venous insufficiency, 50, 52, 69, 72 Vostek sign, 230 circumcision, 308, 326 client advocacy. In pediatric health management, 339, 354 in peripheral vascular management, 48, 65 client care conference, 442, 463 client teaching arterial occlusive disease, 51, 70 atherosclerosis, 54, 74 birth control pills, 445, 466 to 467 congestive heart failure, 13, 32 cystic fibrosis, 85, 103 to 104 SI. Gmoid colostomy, 113, 128 to 129 statements indicating need for, 51, 70 tension type headaches, 179, 198 clinic nurse client assignments by, 177, 194 peripheral vascular management, 46, 62 clinical manager, 309, 327, 437, 457 clonidine, 367, 384 clozapine, 364, 380 cluster headaches, 178, 197. Cocaine, 365, 380 code black, 244, 260 code pink, 305, 321, 338, 353 index 477 code red, 216, 234 coffee ground emesis, 117, 134 collective bargaining, 275, 289, 308, 430, 447 colostomy, 337, 352 community-acquired pneumonia, 88, 107 community-oriented, population-focused nursing practice. 213, 229, 433, 451 composine, 277, 294 to 295 complaints, 279, 296 complementary and alternative medicine, 118, 136, 146, 163, 213, 228, 248, 267, 434, 452 conduct disorder, 363, 378 confidentiality, 11, 28, 82, 99, 145, 161, 371, 391, 442, 463 conflict resolution by charge nurse, 437, 457. Win-lose strategy of, 11, 29 win-win strategy of, 9, 26 congenital heart defects, 343, 359 congestive heart failure client teaching, 13, 32 digoxin administration for, 8, 24 end stage, 12, 30 home health nurse visit for, 12, 31 consolidation, 106 coronary artery bypass graft, 16, 36 corona. Re-bypass surgery, 11, 27 to 28 crash cart, 10, 27 creatinine phosphokinase cardiac muscle, 8, 24 Creed-S maneuver, 144, 159 crepitus, 84, 102 critical care case study involving, 400 to 402, 416 to 417 delegating of tasks to unlicensed assistive personnel, 430, 447 critical care unit prioritization of care in, 14, 35 shift assignments in, 9, 25 Crohn's disease, 434, 453 cultural beliefs, 306, 323 cultural diversity, 82, 98 cultural sensitivity, 50, 69 Cushing's syndrome, 209, 223 cystectomy, 142, 155 cystic fibrosis, 84 to 85, 101, 103 to 104 cytomegalovirus, 210, 224 D. Darvan, 144, 159. Day Surgery Center, 142, 155, 431, 449 Death. See also dying communicating of, to family members, 48, 66, 179, 199 family requests after, 49, 67 from communicable disease, 431, 448 of infant, 309, 327 mortuary service, 431, 448 pronouncing of, 12, 30 refusal of treatment before, 114, 131 renal and genitourinary management, 147, 164 STA. Guess of, 114, 130 decision making, 2 to 3, 308, 326 deep vein thrombosis, 45, 47, 60, 62, 65, 432, 435, 449, 454 Delegation of Care Cardiovascular Management, 9, 13 to 14, 25, 33 to 34 to Home Health Aid, 16, 37, 431, 448 Peripheral Vascular Management, 44, 46, 48, 50, 58, 61, 66, 68 Questions about 4 to 5 to Unlicensed Assistive Personnel. See Unlicensed Assistive Personnel, Delegation of Care Dementia, 178, 196, 365, 381, 394 Democratic Leadership Style, 214, 231, 441, 462 Denial Stage, of Grief, 114, 130 Depakote, 376, 394 Depression Stage, of Dying, 114, 130 Desmopressin acetate, 211, 217, 225, 235 Diabetes insipidus, 211. 224, 230 Diabetic ketoacidosis, 217, 220, 236, 238 Dialysis, 149, 152, 166 to 167, 171 Digoxin administration of, 8, 24, 144, 159 Pediatric uses of, 343, 360 Potassium levels and, 13, 32 Toxicity caused by, 12, 31 Dilantin, 433, 452 Disaster Bomb Scare Protocol, 371, 389 to 390, 441, 462 Hospital. AL Policy 4, 143, 157, 217, 235 to 236 Planning 4, 146, 162, 244, 260 Triaging after, 11, 28, 177, 195, 444, 465 Discharge Teaching Abdominal Aortic Aneurysm Repair, 54, 74 Angina, 21, 41 Coronary Bypass Surgery, 11, 27 to 28 Eye Enucleation, 181, 201 Pediatric Health Management, 343, 359 STA. Timents indicating need for, 54, 74 subarachnoid hemorrhage, 181, 201 women's health management, 306, 322 discharging of clients, 437, 456 discipline, 338, 353, 370, 389 disease-modifying antirheumatic drugs, 281, 298 dissociative identity disorder, 372, 391 distress gastrointestinal management, and 118, 135 neurological management and 180, 199, 201 respiratory management and 78 to 79, 85 to 86, 91 to 93, 102, 104 to 105 diversional activity deficit, 342, 358 diverticulosis, 114, 130 do not resuscitate order, 10, 13, 27, 33, 113, 127, 209, 222, 283, 300. Documentation of fall 16, 37I. And gastrointestinal management, 110, 123 docusate, 10, 27 dopamine, 9, 24 Down syndrome, 337 to 338, 352 to 353 dressings, 240, 253 drug screening, 271, 284, 429, 446 Duchenne's muscular dystrophy, 338, 354 Dulcolax, 148, 164 Durable power of attorney, 115, 131 Duty to warn, 368, 386 Dying. See also Death bereavement counseling, 115, 131 Family issues during, 277, 293 Spiritual distress during, 147, 163 Stages of, 114, 130 Elastic compression stockings, 242, 255 to 256 A label, 370, 389 Elderly abuse of, 47, 65, 442, 463 Blood transfusions to, 45, 6478 Index chronic glomerulonephritis in, 152, 171 Discharge instructions to, 176, 192 Documentation of care, 16, 37 Health promotion for, 144, 158 4 lines in, 147, 164 Relationships between, 443, 464 Vaginal dryness in, 144, 158 Electrical burns, 247, 265 Electrical failure, 439, 459 Electroconvulsive therapy, 3. 72, 392 Email, 83, 100 to 101 Emergency Department Assessment Prioritization in, 178, 197 Floating of nurse to, 8, 23, 242, 256 Payment for services in, 14, 35 Pediatric health management, 339, 355 Women's health management, 303, 317 Emergency preparedness, 162, 244, 260 Employee health nurse, 433, 451 Endocrine management advanced directives, 209, 222 assessment prioritization for clients, 211, 213, 224, 229 to 230 case manager assignments, 212, 228 client assignments to case manager, 212, 228 by charge nurse, 210, 224 clinical scenario, 220, 238 code red, 216, 234 delegation of care to licensed practice nurses, 208, 215, 221, 233 to unlicensed assistive personnel, 207, 209, 213 to 214, 216 to 217, 219, 221 to 222, 228, 231, 233, 235, 237 Democratic leadership style, 214, 231 diabetic ketoacidosis, 217, 220, 236, 238 diagnostic tests, 211, 226 home health nursing, 214, 230. Hospice nurse, 217, 235 hyperparathyroidism, 215, 232 information gathering techniques, 211, 226 insulin, 207, 210, 218, 221, 223 to 224, 236 laboratory tests, 212, 217 to 218, 227, 236 licensed practice nurses in, 208, 215, 221, 233 management-related questions, 208 to 209, 216, 221, 223, 234 medication administration, 210, 224 mind-body interventions, 230 multidisciplinary team in, 211, 224 nursing process, 211, 226 parish nurse, 212, 228 post-anesthesia care unit nurse in, 209, 222 to 223 prioritization of interventions, 208 to 209, 211 to 214, 216, 220, 222 to 223, 225, 227, 229 to 230, 234, 238 t. Triaging of telephone calls, 212, 219, 227, 237 type 2 diabetes, 213, 216 to 217, 229, 234 to 235 unlicensed assistive personnel in, 207, 209, 213 to 214, 216 to 217, 219, 221 to 222, 228, 231, 233, 235, 237 urinary tract infections, 212, 226 to 227 end-of-life care cardiovascular management, 13, 32 gastrointestinal management, 114 to 115, 130 to 131 neurological management, 180, 200 renal and genitourinary management, 147, 163 respiratory management, 83, 85, 99, 102 to 103 end-stage renal disease, 147, 152, 163, 171 epidural anesthesia, 302, 316 epiglottitis, 355, 451 Erickson's psychosocial development STA. Guess, 343, 359 erythema toxicum, 331 erythropoietin, 149, 166, 280, 296 esophageal bleeding, 113, 127 to 128 ethical principles autonomy, 50, 69, 305, 320 fidelity, 275, 290 justice, 338, 354 non-malfeasance, 84, 102, 243, 258 to 259, 308, 325 veracity, 113, 127, 210, 223, 370, 389 ethics commit. E. 308, 326 to 327 evidence-based practice, 44, 58, 115, 131 evisceration, 112, 126 eyes chemical injuries to, 180, 201 enucleation of, 181, 201 F facial edema, 306, 323 falls, 16, 37, 433, 443, 450, 464 family members, 14, 34, 48, 66 fat embolism, 246, 264, 439, 459 fidelity, 275, 290 fire alarm, 46, 62, 341, 356 fire safety, 251, 269 to 270 flaccid bladder, 144, 159 flail chest, 87, 106 fleets enema, 182, 203 floating of nurses to emergency department, 8, 23, 242, 256 to intensive care unit, 80, 95, 274, 288 to postpartum unit, 312, 330 to 331 to psychiatric unit, 367, 384 fluid restriction calculations, 149, 166 fontanelles, 335, 349 Fosamax, 144, 159 G-gate belt, 246, 264 gastric bypass surgery, 119, 137 to 138 gastroenteritis, 118, 136, 334, 348 gastrointestinal management assessment prioritization for clients, 109, 111 to 112, 118 to 119, 122, 125 to 126, 136 to 137 client as assignments in, 116, 132 client teaching, 113, 128 to 129 clinical scenario, 120 to 121, 139 to 140 delegation of care to licensed practice nurses, 119, 138 to new graduate nurse, 110, 120, 123, 139 to unlicensed assistive personnel, 109, 112 to 116, 118 to 119, 121 to 123, 126, 128 to 130, 132 to 133, 135, 137, 140. Diagnostic tests, 109 to 110, 122 to 123. Distress considerations, 118, 135. End-of-life care, 114 to 115, 130 to 131. Ethical principles, 113, 127. Home health nurse, 114, 130. Laboratory tests, 111, 117, 125, 134. Management-related questions, 110, 112, 115, 123, 127, 132. Medication administration, 117, 134. Multidisciplinary team in, 110, 123. Nursing process in, 111, 116, 118, 124, 133, 135. Ostomy care, 112, 125. Preoperative care, 112, 126. Prioritization of care and interventions, 109, 111 to 112, 114, 116 to 120, 122, 124, 126, 129, 133 to 135, 137, 139. Refusal of treatment, 114, 131. Index 479. Sigmoid resection, 117, 135. Surgical complications, 111, 125. Unlicensed assistive personnel in, 109, 112 to 113, 115 to 116, 118 to 119, 121 to 123, 126, 128 to 130, 132 to 133, 135, 137, 140. Genitourinary management. See renal and genitourinary management. Genitropin, 235. Glasgow Coma Scale, 184 to 186, 203 to 205, 346, 362, 432, 449. Glomerulonephritis, 152, 171. Good Pasture Syndrome, 143, 156. Graduate nurse. See new graduate nurse. Grasp reflex, 331. Graves' disease, 212, 227. Grief, 114, 130, 369, 387. Guided imagery, 248, 267. Guillain-Barré syndrome, 173, 175, 188, 190. Health insurance, 308, 326. Health promotion, for elderly, 144, 158. HELLP syndrome, 330. Hematocrit, 283, 300. Hematological and immunological management advanced directive, 274, 288. Assessment prioritization for clients, 277, 293, 431, 449 client assignments by charge nurse, 272 to 273, 279, 285, 287, 295 by home healthcare nurse, 276, 292 to licensed practice nurses, 282, 299 clinical scenario, 282 to 283, 299 to 300 conflict. T resolution, 273, 288 delegation of care to home health aide, 276, 291 to licensed practice nurses, 272 to 274, 280, 282, 285 to 287, 289, 296, 299 to new graduate nurse, 279 to 280, 296 to 297 to unlicensed assistive personnel, 272 to 275, 278 to 279, 282, 285 to 290, 294 to 295, 299 end of life care, 272, 286 H. Home health nursing, 276, 291 hospice care, 276, 292 intensive care nurse, 273, 287 laboratory tests, 275, 290 licensed practice nurses in, 272 to 274, 280, 285 to 287, 289, 296 lung cancer, 272, 285 medication administration, 277, 293 nursing interventions, 281, 297 to 298 prioritization of interventions, 271 to 274, 277, 280, 282 to 286, 289, 293, 297, 299 to 300 quality improvement project, 275, 289 unlicensed assistive personnel in, 272 to 275, 278 to 279, 282, 285 to 290, 294 to 295, 299 hematuria, 169 hemodialysis, 152, 171, 215 hemoglobin, 81, 97, 283, 300 hemoglobin A1c, 217, 236 hemothorax, 86, 10. 5 hemovac, 119, 137 heparin, 15, 19, 35, 39 herbal supplements, 146, 163, 213, 228, 342, 359 HIV injections, 344, 360 hierarchy of needs, Maslow's, 3, 194 high Fowler's position, 123 HIPAA in integumentary management, 246, 263 in mental health management, 368, 385 in pediatric health management, 341, 357 in renal and genitourinary management, 142, 155 violations of, 98 to 99, 146, 161, 246, 261, 263, 279, 296, 340, 357 histoplasmosis, 79, 93 HIV positive, 281, 298 home health aid conflict of interests by 13, 32 delegation of tasks to 16, 37, 431, 433, 448, 452 education of 276, 292 in hematological and immunological management, 276, 291 professional boundary crossing by 13, 32 work-related injuries, 430, 448 home health care agency, 434, 442, 452, 463 home health case study, 406 to 408, 421 to 423 home health nurse/nursing cardiovascular management, 12, 29 to 30 CLI. Anti-assignments, 433, 451 to 452 congestive heart failure management by 12, 31 endocrine management, 214, 230 gastrointestinal management, 114, 130 general questions about, 430, 444, 448, 465 to 466 integumentary management, 249, 268 neurological management, 178 to 179, 197 to 198 new graduate nurse in 13, 31 peripheral vascular management, 46 to 47, 55, 63 to 64, 75 prioritization of interventions, 434 to 435, 452, 455 referrals to 55, 75 renal and genitourinary management, 146, 163 hordeolum, 199 hormone replacement therapy, 144, 158 hospice bereavement counseling, 115, 131 end-of-life care in 13, 32 hematological and immunological management, 276, 292 referral to 83, 99 to 100 hospice nurse in cardiovascular management, 13, 33 in endocrine management, 217, 235 in hematological and immunological management, 277, 294 in peripheral vascular management, 48, 66 task delegation by 2. Volunteer, 13, 33 triage by 13, 33 hospitals chain of command in 462 disaster policy of 143, 157 electrical failure in 439, 459 hotspot questions, 183, 203 human papillomavirus infection, 311, 329 hydrocodone, 49, 67 hyperparathyroidism, 212, 215, 227, 232 hyperthyroidism, 215 to 216. 234 to 235 hypochondriasis, 364 to 365, 379, 381 hypokalemia, 133 hypoparathyroidism, 230 hypophysectomy, 217, 235 hypothyroidism, 217, 235 ibuprofen, 49, 67 imagery, 230 immunizations, 81, 97 immunological management. C. Hematological and immunological management impetigo, 246, 263 480 index incompetent client, 78, 92, 146, 163 increased intracranial pressure, 181, 186 indural, 43, 57 indwelling catheters, 143, 151, 158, 170 infection control nurse, 278, 295 infertility referrals, 307, 323 to 324, 435, 4. 53 influenza immunizations, 81, 97 information technology guidelines, 342, 357 to 358 informed consent, 78, 92 for blood products administration, 8, 24 for intravenous pyelogram, 146, 163 pediatric health management, 339 to 340, 354 to 356 insulin, 207, 210, 218, 221, 223 to 224, 236, 339, 355 intaken. D. Output calculations, 87, 106 integumentary management assessment prioritization for clients, 239, 252 burns, 247, 250 to 251, 265 to 266, 269, 436, 455 case management, 243 to 244, 259 to 261 client assignments by charge nurse, 242, 245, 256, 261 to 262 client complaints, 244, 259 clinical scenario, 250. 251, 269 to 270 delegation of care to home health nurse, 249, 268 to licensed practice nurses, 245, 247, 261 to 262, 266 to unlicensed assistive personnel, 241 to 242, 244, 247, 250 to 251, 254 to 256, 259 to 260, 265 to 266, 269 to 270 diagnostic tests, 246, 264 disaster responses, 244, 260 electrical burns, 247, 265 fat embolism, 246, 264 home health nurse, 249, 268 laboratory tests, 241, 245, 254, 262 legal requirements, 243, 245, 258, 262 licensed practice nurses in, 245, 247, 261 to 262, 266 management-related questions, 243 to 246, 258 to 259, 261, 263, 439, 459 medication administration, 240, 248, 252 to 253, 266 multidisciplinary team in, 242 to 243, 248, 256 to 258, 267 Nursing Care Plan, 244, 260 Nursing Process, 240 to 241, 253 to 254 Physical Therapy, 243, 245, 257, 262 to 263 Pressure Ulcers, 246, 264 Prioritization of Interventions, 239 to 241, 245, 247, 249 to 250, 252 to 254, 262, 265, 268 to 269 Rehabilitatio and Nursing, 247 to 248, 265, 267 Therapeutic Communication in, 243, 245, 258, 261 Triaging of Telephone Calls, 246, 263 to 264 Unlicensed Assistive Personnel in, 241 to 242, 244, 247, 250 to 251, 254 to 256, 259 to 260, 265 to 266, 269 to 270 Vocational Referrals, 248, 267 Intensive Care Unit Assessment Prioritization. N of Clients, 441, 461 Floating of Nurses to, 80, 95, 274, 288 Transferring of Client to Surgical Unit, 439, 459 Intensive Care Unit Nurse Hematological and Immunological Management, 273, 287 Prioritization of Clients, 79, 93 Respiratory Management, 79, 86, 93 to 94, 104 International Normalize. D ratio, INR, in atrial fibrillation patient, 11, 28 Description of, 10, 27 Therapeutic range for, 443, 465 for warfarin, 15, 36, 46, 63 Interstitial cystitis, 143, 156 Intramuscular injections, 334, 345, 348, 361 Intravenous pyelogram, 146 Intubation, 85, 103 Iodine allergy, 178, 197 Isot. Retinoin, 241, 255 for fluid administration, 342, 358 for lines, 147, 164 for pump rate calculations, 52, 55, 71, 75, 117, 135, 213, 228, 344, 360 J. Jaundice, 111, 124 Jehovah's Witness, 306, 322 Joint Commission, 84, 102, 319, 443, 464 to 465 Justice, 338, 354 K. Kaposi sarcoma, 178, 196 KUB. 150, 169 L. Labor and Delivery, 301, 306 to 307, 310, 314, 323 to 324, 328 to 329, 444, 466 labor strikes, 308, 326 laboratory tests, prioritization of care based on cardiovascular management, 18 to 20, 38, 40 endocrine management, 212, 217 to 218, 227, 236 gastrointestinal management, 111, 117, 125, 134. General questions about 433, 452 hematological and immunological management, 275, 290 integumentary management, 241, 245, 254, 200